Welcome to the RevMD podcast with me, your host, Dr. Debra Durst, and I have my co-host with me.
Hey guys, Farideh Golembiewski, nurse practitioner here at RevitalizeMD.
So at RevitalizeMD, we have an active practice that specializes in wellness and sexual wellness. And so we do a lot of patients, both men and women, that have both wellness concerns and sexual wellness. And so we do a lot of topics relating to sex. And so today we're going to cover one, and it'll be a fun one, most Googled sex facts, just some things that people are looking at. You had another term for that entire thing.
Oh, the search history confessions.
Yes, exactly.
Do you want us to go through your search history?
Yes. So that's what we're covering today. And again, it's interesting because then we have conversations all day long with patients about sex. And if you look at like sexual medicine, most things are surveys. So conversations probably rank right up there with about as good as science you're going to get and so this was a good topic for us to do because we know what people are asking when they're in the office, and it kind of goes along with
And then what are they
Googled
Googling?
sex facts. Yeah. Same thing, right?
Right.
So
and this leads to kind of what we talk about it often is, what are the benefits of sex? Is sex an important part of the relationship, of life? What does it alter? What does it affect? And of course, when you Google questions online, what do they revolve around?
those same questions. Yeah. And so we'll go down the list and then give you a little insight into the conversations we're having with patients every day and whether it kind of correlates with what they had said. So basically the first one is, are there benefits to having daily sex?
So this one's interesting. So we know that when you engage in sexual activity, there are neurotransmitters in the brain that are activated and that there are benefits to sexual activity. But you had read a study that there was a relationship between how often and then more didn't necessarily mean better.
Yeah, there was one study that kind of said more isn't better. And I think that's like just a good term, like more isn't better. But then we had some other studies that is like sex and death, are they related? And kind of said the opposite. And honestly, I don't know that more is better necessarily, but quality for sure.
And regularity.
Yes. And so I think that is sex on a daily basis beneficial physiologically? And the answer would be yes. It's like exercising daily, and it does to the body the same things that exercise does. So it's increasing your heart rate, your blood pressure in appropriate ways, getting a cardiovascular workout. And then what you mentioned is, again, you have hormones that are released with all the benefit and positive benefits of those being released as well. So not just the cardiovascular benefit.
So, like Dr. said, it can lower your blood pressure. It can improve heart health. It can improve the immune system.
Yes. And so when we say, like, again, when I say increase and heart rate and blood pressure, we're talking about acutely, just like you're exercising.
Like a cardio, like you're running on a treadmill.
Yeah. But ultimately it's lowering it. And just think about those fluctuations in between a increase in cardiovascular workload and then a decrease also improves your heart rate variability ultimately.
It's like a HIIT workout, right?
Like a little HIIT workout. I know. And it doesn't even have to be a little. It could be a longer too. So, but also improves your immune function, self-esteem.
It can improve depression and anxiety. Yeah. So there's some mental health benefits there. And like Dr. Durst said, it can improve self-esteem.
Yeah, and lower your cortisol and your stress. And that's one of those hormones that are released. And again, use it or lose it is a big thing. And so, and that is the case. So the more sex that you have, the more hormone release and production that you have as well. And so still peters over time, for sure, that your hormones are decreasing with age, but still you have an increased production when you're having more sex. So, and better sleep. So there's this, so I would say that that's a very commonly Googled fact, obviously. Yep. And I think that a lot of patients for us end up in front of us because, again, they're not having sex as frequently as they were. That is affecting relationships. And so, and they're actually looking to have, it on a daily basis frequently. And then it's funny because we've had some, husband and wives, and we see a lot of couples that will say, like, we haven't had two-a-days. and years.
In
And
years.
now they're having even 2 days. So
Yeah.
all good
So
news.
it increases intimacy within your relationship, which is really important for
Yes.
every relationship.
Yeah. So the next one is, what is a healthy frequency of sex? And so I really look forward to all the comments with these as well. Of
course,
they're always
'cause there
fun.
will be.
There will be a lot. So frequency of sex, how frequent is, what's normal? You know, what do most couples find acceptable? And
So, according to a study, it said for couples specifically that healthy frequency would be once a week.
yeah. Yeah, and I think that, again, there's a lot of different resources I've read recently, and it, I think, even gets down to where they almost consider an active couple to be, I don't know, some, like 10 a year or less, so it's even lower than that for
Yeah.
some. I don't think, again, if you're
Now we're
looking
going at age and
yeah.
time of life and lifespan, that would definitely change.
Yeah,
I would
maybe. Doesn't
maybe
have to, shouldn't have
I
to,
know.
right?
I mean, I say that, but then
Yeah.
we see patients in our office that are well in. We've got couples that are in their 40s and couples that are in their 60s, and not much changes between frequency once their hormones are optimized.
Yes. No. Well, and I think that with this study, it said once a week was normal,
Or healthy.
or healthy. And then there's sources definitely that I have read that have said less frequent than that. But then again, we're back to that same question, is more better? And it sounds like there are definitely daily benefits to having sex. But it has to be normal frequency for the couple. So I think the most important thing about how frequent is it for you as a couple? Because you've got to match up, right? And so if one wants to have it daily and one wants to have it weekly, that's probably an issue that needs to be addressed.
And in
so,
this study, it had that 50 to 60% of the couples that they had looked at had engaged in weekly intimacy.
yeah.
So even off the mark, right? If only half are meeting that, and we know all the benefits.
Yeah, all the benefits. So only half of them are doing it, weekly.
And that goes back to kind of what Dr. Durst was saying in the beginning. We do a lot of hormone replacement, and a lot of that has to do as we age, our hormones change for men and women, and that libido or sexual desire tends to decrease. And there's definitely something you can do about that.
So the next one was very interesting. Is sex really important in a relationship?
Yeah, I don't know how it could not be.
And that was kind of the answer given, but it is extremely important to our patients because we have a very active sexual wellness patient population or active practice. And what's interesting is they don't have a lot of sources to go to have conversations. And now it's being talked about a lot more, but they still don't have actual offerings like from a traditional doctor or practices even in a local vicinity for a lot of our patients. And so it is a benefit for us being able to have those conversations, open those conversations, and they want that. And
Conversations about sex and relationships should not be taboo. They should be able to be open conversations you have with your provider and primary care, at your GYN, at the urologist, at definitely an office like ours, but this should be something that is more widely discussed.
yeah.
And patients don't have options, and that's how they end up in front of us oftentimes.
Yeah, and so I think it is very important. It's very important, but it is taboo, and you don't have a really good place to go and talk about it to see how to solve the problem if you're not having sex. But I would say that's the one thing that separates a friendship from a relationship, right? Is intimacy. And so if you don't have that, then
Your friends.
yeah, you're friends. And so that's the one thing that is separating, a friendship from a relationship. Because if you're not having sex, then there
Your
is no
roommates.
intimacy in your roommates. And so I don't think that's normal for a lot of people. And I think that, there is a drive to have sex. And if you're not having sex, then you have to question what is going on and how to solve it. But I think the big important fact is it matching? Because if both have a low sex drive and they're happy with once a week or once a month, great. But if one has a high sex drive and one doesn't, then that's a match and that needs to be fixed. Or you run into issues.
And that's where how can it not be important? So oftentimes we will see it may not be on the top of your list, but maybe it's on the top of your partner's list. And so it is important to them, which means it is important to your relationship. So matching is very important. We don't, we have little jackets that say no man left behind, but at the same time, no woman left behind either. And we see more women in the office trying to meet that sex drive of their partner more often than not.
Yeah, and they feel bad even for not initiating, say they'll have sex, but they're not initiating, but they used to. So I think that sex is the reason that most couples end up together. So it's definitely intense at the beginning. Usually that is part of why, again, you have a relationship and not a friendship, because we have lots of friends and then we don't have as many relationships. And so you have a relationship because you have now become intimate. And so the sex is more frequent at the beginning. Yes, it's going to decrease over time, potentially. But if it decreases over time and one or both aren't happy with it, that is a problem that needs to be addressed, or that ends up as a bigger problem. And so I think that people that have a mismatched sex drive definitely have a higher risk of divorce rate. And so because that's
in a
huge
lot of
problem.
cultures, it's the ultimate way to connect.
Yeah.
So
True. So,
All right.
and that brings us down to the sex and intimacy.
So not all intimacy is sexual in nature, right? We talked about, I think we did a podcast on this actually.
We did way back. We did this where what's sex versus intimacy?
Yeah.
And that's this question that was Googled. And so what is the difference? Well, again, intimacy is the connection.
It's that connection. It can be the cuddle. It could be the hold handing. It could be the, we Netflix and chill or whatever, it is that time spent together that doesn't necessarily have to be sexual in nature. Where sex is the act.
Yeah, and sex is actually the act, although I would sometimes venture to say that also, there's a lot of intimacy that leads up to, and is it sex? Is that the penetration versus the other? And so sex technically is both non-penetrative, penetrative, and penetrative.
True.
So I think that's where it comes down to. It's both, but intimacy is you connecting with that person on a relationship level and a love connection. And again, that's what I think differentiates
Spending
us.
Time together, right?
Differentiates us from a couple versus a non-couple, like a friendship versus a relationship.
Yeah.
And again, I think that we're going to shortly here, we probably are already going through a sexual revolution with no boundaries. And so that may all change. And I'm sure we'll get blown up on the comments, and we look forward to it. We love that.
Love
so
it.
Please do.
Guys, I just heard about autosexuality.
Yeah.
Didn't even know it was a term.
So what is it exactly?
It's when you love yourself more than other people. You are sexually attracted to yourself more than anyone else.
Yeah. Yeah.
I'm like, it's crazy. So all these new terms, all these new things, like you said, there is a sexual revolution out there. It is becoming more talked about. There is more openness about sexuality. There are more terms, right? There's these new classifications.
New terms, new transitions, there's all kinds of, so there is a sexual revolution going down without boundaries. So it'll be bigger than before, but we look forward to, again, embracing all of that and opening conversations and those taboo conversations. We do that on a daily basis. We're more than willing to do that here as well.
Yeah.
So leave your
what
comments.
do you Google? Put it in the comments and we'll answer.
Yeah, what do you Google,
lucky, right?
and what are your answers to this? Frequency of sex, is it important in a relationship? Is intimacy different than sex for you? We want to hear all the things, and let us know if you want to deep dive into anything else, because we are willing to dive into anything sexual wellness or wellness.